Hi, we're here today with Desda Zuckerman, who is a paradigm-shifting new thought leader, international speaker, healer, and teacher, and author of this amazing book, Your Sacred Anatomy, The Owner's Guide to the Human Energy Structure. And we're going to talk a little bit today about the fact that Desda is teaching subtle anatomy for medical professionals, and why medical professionals might be interested in learning what you have to teach.
Well, there's a lot of reasons, actually. But the biggest one, really, is that medical professionals are caring, loving people. Mm-hmm. And the training that most of them have gone through has taught them to experience a thing called professional distance. Mm. And professional distance, while better than becoming soppy and over-involved with your client, mm-hmm. is something that puts a wedge between people. Mm. So often, human beings don't feel heard and seen by their medical professional. Mm-hmm. And so for years, people are trying very, very hard not to connect, which is exhausting.
Right.
It's less exhausting to actually connect a little bit. Mm-hmm. So, the quandary has been for a long, long time in medical circles, how can we be with people and not take on their energy, the depression they're in, the illness that's devastating their body, mm-hmm. or just the bigness of who they are? How do I not take that on? Mm-hmm. And the other thing is, how do I become resilient and strong and work through a long day, a 10 or a 12-hour day, without having a big energy drop or needing to eat a lot of sugar or drink coffee and sugary drinks?
Yeah.
So this is the quandary that's been on the table. Now, I started out in the early 1970s studying to be a medical assistant.
Okay.
And I was a professional medical assistant for a couple of months.
Okay.
Because I couldn't take it.
Oh.
I couldn't hack being in a room with somebody who had stage 4 cancer and was terribly, terribly ill. I couldn't take how that made me feel. And it wasn't because I was emotionally immature particularly. It was because the energy of that and the drugs that the people were on often were so intense for me. So I, as a very sensitive, clairvoyant, clairaudient person, was very affected by that.
Yeah.
And I had to learn how to be in the world as a sensitive and not be in danger, not be less than who I wanted to be.
Yeah.
So, over time, it became clear to me as I began to really explore and study the human energy structure, which I've mapped in my book. I began to realize that there was a way to be in the anatomy, to use the anatomy consciously, and to interact with other people from that anatomy. And that this would actually create professional distance without that gulf between me and other people. So I was able to be with them, touching them at a soul level, at a more spiritual level, and yet use a part of myself that was perhaps even a more powerful part of myself than the physicality. So as I started to put this together, it became extremely clear that this was something that was going to be very valuable for medical professionals. So when I began to officially teach in the late 1990s, I started to attract to me almost instantaneously people who did healing. And it's really escalated from that. So now I'm really focusing specifically on training medical practitioners.
Okay.
And that's where my interest lies, because we want to turn caregiver burnout into caregiver resilience. And we want to take the idea that we have to merge or somehow push down our clients. We want to take that idea away, and we want to allow people to have an experience of being with that isn't compromising in any way. So that's what we're doing. And there's a class called the Illuminated Body for Professional Healers that I've developed that is amazing. I mean, it's really cool. We've taught it to hundreds of people at this point, and everybody is really loving it. People are using it in major hospitals all over the United States.
Wow.
Soon to be in Europe. I'm taking this to Spain in the end of the year, so this is going to be very exciting. And what people really are learning from this is that they can do what they do better.
Oh, yes. It enhances the skills they already have.
It does. Because they have this extra ability to be with other people in that very unique and different way that we teach in CoreIndividuation.
So it sounds like what you're describing people learn is the stance of being a professional healer.
Exactly.
That allows you to interact with your patient from this level of awakened compassionate, like a compassionate stance in the structure, where you can be fully present and fully available, and yet not take on their pain and their suffering, not merge.
Yeah.
And you can go home without feeling drained. In fact, you can go home feeling maybe even uplifted and empowered, that you're allowed to be the biggest, most expansive version of who you are, and do your work even more effectively.
That's exactly it, Samantha. That's exactly it. And I know you've studied to be a CoreIndividuation practitioner, so you're really learning this model and coming to it in a big way. And the thing that I know about people, as they learn the edge, which is what we call this technique, the edge technique, as they learn the edge technique, they start to take ownership of this bigger part of who they are. We could call it the soul, or we could call it your higher, more authentic self. But what it is, for sure, is a larger dynamic and a bigger version of you. Not overwhelming, not overpowering, not harsh or lacking some form of compassion, but in fact addressing that at an even greater level. So really what I started to call the edge was the seat of compassion, or Kuan Yin's heart. This is another one of my favorite names for it. But it really is the seat of compassion in the human energy structure. So if we can locate that place in a person and help them understand how to get there themselves and how to use it, they don't absorb toxicity. So even if you're working with someone who's really toxic, for whatever reason, psychologically, emotionally, physically, or even spiritually toxic, you don't pick that up. They simply have that experience in your presence, and you are with them. You are simply with them. So it really promotes the concept of the deep witness.
You know, and one of the things that brings to mind is if I'm fully inhabiting my structure, and let's say you're my patient, as I'm interacting with you, it's on a subtle level reminding you as the patient of who you really are, and possibly expanding your own innate healing capacity.
Well, it really suggests that there might be an end to pain and suffering. You know? I mean, everyone suffers, everyone struggles. We all do. But if the healer can hold out the possibility that some part of what they're doing presents an end to pain and suffering, then the experience becomes not a grueling, difficult thing that you must suffer through, an ordeal you must endure, but it becomes a joyous expansion into your own truth and your own beauty. And this is what's possible. This is real healing. And it's exciting that medical professionals want this. Of course they want it. Why wouldn't they, you know? These are beautiful people. I have nothing but love and respect for medical professionals because they have devoted their lives and their pocketbook to really attaining knowledge. And here in the 21st century, we have to know that all of this knowledge is for everyone, not just small streams of knowledge, but knowledge about deeper spiritual and etheric understandings, as well as how to put a proper IV line in.
Yeah.
But just think about it. What if when you gave someone a medication, you could attune the medication to them, and you could support them to have an experience of receiving a helping medication as a friend, and not as a grisly experience or a difficulty thing, which is a difficult thing, which is what many people see drugs as being. A difficult thing they have to endure.
Yeah, and then one of the most difficult things is the side effects that often go along with these pharmaceutical medications.
Yeah.
That, you know, oh, it's helping you, but it's also having all these adverse complications. So how does that affect side effects to attune medication?
Well, we are very happy to say that side effects are reduced by attuning medications. This is something that we've been studying for quite a while now. I personally have been studying it for over 20 years. We have yet to do a scientific study, but what we're doing is science, because we are following the information, and with as clear and as clean an eye as we possibly can have. We are looking at, is this better? Is this not better? And what we're seeing is that people in chemotherapy taking very strong drugs are having less hair loss, less nausea. But the best thing we see is really the rapidity that people are experiencing with recovery. The speed of recovery with intervention from CoreIndividuation and the energies we work with and the procedures we do, the clearings and alignments for the subtle anatomy, what we are seeing is speedier recoveries. And this is pretty much across the board. And I started seeing that almost instantaneously when I started doing healing work. I mean, it immediately started. I remember a gal who was in her early 60s getting a knee replacement. She was a terrific dancer and really just worn out her knee. She got the knee replacement. She healed so fast. The doctors were saying, wait, you can't possibly be healed. And yet she was standing up, bending, doing deep bends, and all kinds of things that nobody thought she could do. And really the only thing she had done that was different was CoreIndividuation and how we had supported her. So attuning medications, working with energies to support a speedy recovery, removing the signatures of anesthesia and difficult experiences that people go through, such as a shock, for example, or deep trauma. Removing these signatures out of the energy structure, all of this speeds recovery and helps people experience their own healing journey as something very, very empowering.
So there's just one more thing that comes to mind, is that CI actually provides a whole suite of pre, during, and post-operative care that dovetails perfectly with allopathic medicine and surgery.
It does. I've got a program called CI Medicine Bag Carrier, and this is the first certificated program that I offer. After that is practitioner training. But this program specifically teaches the post, pre, and during surgical support. And what I see with surgeries when they're being held this way is recovery time is faster, surgical results are better, there's less bleeding, there's less need for meds. I've had people go through major surgeries without drugs. I had one gal who had a broken ankle, severely broken ankle, needed plates and pins and all kinds of things, and I supported her with almost exclusively using our techniques because she was allergic to pain meds, so she couldn't take them. So we used our techniques to help her get through the process of healing, and she healed faster than anybody thought she should. And she had osteoporosis. Even so, she's walking within a month. So it was just amazing to see. So there are incredible results that we're seeing. We can't claim anything, of course, but we are seeing incredible results, and we'd love to share them with the medical community so we can get some studies done.
And you've talked at UCSF the Symposium on Integrative Medicine. You
Yes.
were a keynote speaker there. And coming up next month, you're going to be talking at Kaiser Permanente in San Rafael. And this is just so exciting that, you know, the medical establishment seems to be inviting you in with open arms and really understanding how energy healing and allopathic medicine can work perfectly together.
You know, we're at the beginning of a new age. And I really think what's happening is there's this explosion of consciousness. And that's affecting everyone, including institutions.
Yeah.
And they're saying yes. And the other thing is, too, is that the alternative medicine dollar or purse has taken a big bite. So a lot of people are choosing acupuncture and chiropractic and all these alternative modalities. So the mainstream healers are saying, hey, wait a minute, what's that about?
Yeah.
And we're getting a more blending. Kaiser now offers all kinds of things that they didn't 15 years ago. So it's really exciting to see this growth and development, and not just Kaiser, but all these other medical institutions. University of California has this whole incredible Osher integrative studies program that they put their doctors through if they want to study integrative medicine. It's exciting.
Wow. It's really exciting. So the steps that medical practitioners should follow if they want to learn from you is maybe host a class at whatever your work is, you know, Kaiser or UCSF, whatever. Invite Desda to come and speak. And then, of course, people can sign up for Illuminated Body, which is your foundational training about how to be in the healer stance.
Right.
Right? And then people can take energetic hygiene to learn how to have really great self-care so they don't get depleted. And they can really be on top of their game all the time. And then after that, there's Med Bag.
Yeah.
Yeah.
CI Medicine Bag, and accompanying CI Medicine Bag is its sister class, which is called The Ethical Healer.
Great.
Where we really talk about the ethics of healing, especially the ethics of energy medicine.
Okay. And then after that, there's a practitioner training, and there's actually 4 levels of practitionerhood.
Yeah.
But people can start actually working as a certified CI person with MedBag skills.
Right.
Right, okay.
They can.
So if people want to learn more about how to sign up for these classes, what's the best way for them to find you and register?
Well, our website's the ticket.
Okay.
We've got it all ready to take registrations for everything that I'm teaching, and that's yoursacredanatomy.com.
Okay. So please go to yoursacredanatomy.com. Please invite Desda to come and do talks at your medical establishment for your community. We do private talks and public talks. And also, please sign up for Desda's Illuminated Body class and her other trainings. I, as a practitioner, can tell you my world has opened wide with this knowledge, and I'm so excited. I want everybody to have it. So thank you so much, Desda, for your 45 years of hard work, dedicating your life to this path, and thank you for being a light guiding our way.
Thank you, Samantha.
Okay.